That brings us on to Clause 22, Amendment 159A. I should note that Lord Howarth of Newport will be taking part remotely. So Amendment 159A, Lord Mawson.
My Lords, I have listened carefully to the debate taking place in your Lordship's House over the last few weeks with great interest and noted the growing consensus that now exists across this House for transformation and change. These debates have shown this House at its best. It is clear that this government now has before it an opportunity to transform not only the NHS and its culture and ways of working, but also the public sector, much of which is not fit for purpose in this century. People inside and outside these systems know this. Listen to those who are leaving for early retirement. At the same time as listening, I've been talking to colleagues around the country, both inside the NHS systems and those responsible for the development of ICSs, and those outside who are seeking to transform the health and care world and who wish to partner with these systems. I thought I would first share a few concerns that I hear because they relate to these two amendments that I now need to speak to, 159A and 210A. Firstly, colleagues both inside and outside the NHS systems have heard fine words from governments before about change and transformation in health and care, but they are sceptical. They know that the civil service and government systems and mindsets are not fully fit for purpose. The civil services culture and mindset needs to transform. It needs to get interested in what is happening among young entrepreneurs in Bradford, for example. The voluntary and social enterprise sectors need government to now get beyond fine words and to deal with, for example, the situation my colleagues at the Bromley by Bow Centre have to deal with every day, as the noble Baroness Lady Cumberledge mentioned last week, as they navigate 41 different funding streams coming up the silos from the Treasury at enormous cost and wastage of time as they try to deliver integrated services. If we are to build a more integrated health care programme, then these practical issues are going to get worse, not just in East London, but across the country, unless we now address this detail. Many years ago, we had a secondee from the Treasury in Bromley, and he told us how all tax revenue was paid into one bank account. How much does it cost to then spread this out across 41 government departments and programmes, only for it all to be brought back together to address the multiple and complex and interlocking issues that somewhere like Bromley by Bow faces? How much cost does it really add? No one knows. 20%, 30%, more? No wonder we have a productivity crisis. My Lords, the Single Regeneration Budget Programme was an early attempt some years ago now by the civil service and government to bring funding streams together. Can I ask the Minister, what lessons have been learned in government and in the Treasury from it? I suspect there is no memory in the system of this programme. There is also a danger of the NHS and public sector culture imposing itself on the voluntary and social enterprise sectors as they try to innovate and generate new ways of working, putting what I call old men in new clothes. I have seen this in the housing association movement, which I was involved in the very early days, and in what happened to children's centres, which were launched in Bromley by Bow by a Labour government, which then unwittingly undermined our integrated model and ways of working with local families. My colleagues in parts of the country can already see the NHS centrally trying to impose its old processes on them as they innovate at the very moment there needs to be a two-way street and real learning taking place. The centre needs to learn from the micro, from the innovation platforms we have created, not impose its outdated systems on them. My Lords, government needs now to show a clear resolve to transform the culture of the NHS, or people will become even more cynical. The whole system and culture desperately needs change, and the way into this is via the micro and practical details. Yes, it will take time, but first we must be clear about why we are taking these initial early steps and where we are trying to get to. There is a real danger of our civil service systems unwittingly deepening poor quality outcomes and a dependency culture. The centre should see these innovation platforms as a place that can teach the centre, not the other way round. We need new behaviours from NHS England, not last-minute processes that want everything tomorrow. The macro needs to learn from the micro. The whole system needs to return to first principles and create an environment which encourages healthy communities. Levelling up is surely about addressing the UK's productivity gap, especially in marginalised communities, and one way of doing that is via a healthy and thriving population. It's also the only way to stop the NHS taking an ever greater percentage of the UK's GDP. I suggest now health is everybody's business. My Lords, my two amendments fit within this mindset and suggest some first steps that could be taken along this road. Let me now deal with my first amendment, 159A. My Lords, true subsidiarity cannot be achieved without delegation of resources and the authority to allocate in a way which will achieve the intended and agreed objectives. For example, systems may wish to ensure that discretionary local services, such as community centres, community transport, struggling family support, Meals on Wheels, should be prioritised and sustained ahead of further spend on health capacity, given their key role in supporting ongoing independence and social cohesion and preventing the need for health services. Place systems may choose to pool delegated resources in order to commission collaborative services at scale where they jointly agree that they are not best placed to provide such services, and such discussions are already taking place in mature systems. For example, in North West Surrey, we have agreed to jointly commission dermatology services across two place systems. The point being that delegation to place does not work against the development of services at a wider scale where that is appropriate, but the recognition of this needs to come from the place level. True transformation, true to the spirit of the bill, the long-term plan, and to achieving the intended benefits of integration cannot be achieved without the freedom to invest those resources in a way which can unlock long-term benefits. This may require speculative investment in some cases, as well as investment in preventative services which do not offer rapid returns, but which are essential to maintaining the ongoing sustainability of services. We would not expect any of this to be done without due diligence on the capability of place-based partnerships and appropriate levels of holding to account for achievement of improvements and results. The ICS will have a key role, not only in ensuring that funds are delegated appropriately, but also in supporting place-based systems to build the capability to manage delegated funds effectively. We need to make leaps in how health services are now delivered through integrated services and offers to populations, by thinking radically about who can support people best, in what way to keep them healthy, looking after them at home where possible and provide services which understand people as individuals and meet their needs holistically. This degree of change in public health, prevention and provision of services needs innovative and broad-based collaborations and partnerships between organisations, health organisations, local authority organisations, VCSE and business, tailored to fit the need of the place. And these relationships are not quick to build. They take time and they take effort. The work takes years. The impact can only be seen through long-term relationships and stable partnerships. So for this to succeed, the ICS will need to embrace the principle of subsidiarity, delegating meaningful responsibilities and accompanying budgetary responsibility to place level. And this may mean that standard procurement cycles and processes don't immediately bring the outcomes the bill envisages. More innovative processes and timings may be needed to ensure that the benefits brought through long-term relationships and stable partnerships are given time to be achieved. Let me now deal with Amendment 210A. My Lords, in general, NHS bodies do not currently make best use of their local voluntary community, social enterprise and faith sectors in terms of procuring services to achieve key health outcomes, especially prevention and early intervention services. This is all well understood. But somehow we never seem to get beyond one-off experiments or short-term, time-limited initiatives. By contrast, the best local authorities have been procuring and partnering with their VCFS for many years, though this has become more difficult in recent funding pressures. There is an opportunity, therefore, for health colleagues to learn from their local authority colleagues in the ICS from the best practice in this regard. With NHS vacancy rates at their highest levels, together with waiting lists for treatment, now is the time to take a whole system approach, to look more collaboratively across the local community. There is also a strong value for money argument as well. Simply waiting for people to become seriously ill, which is what is happening in practice at the moment, but not by design, with regard to many mental health services, but could equally be applied to services for struggling families, leads to very poor outcomes and is very expensive. Using VCFS organisations and others with a combination of staff and local volunteers to create a coherent health rather than illness-orientated approach will pay dividends, but only if there is real intention and focus over a sustained period of time. It's a long-term play, not a quick win, but vital nonetheless. My Lords, traditional models are not working for the groups who can offer most value. Local charities and social enterprises tend to be funded on a hand-to-mouth basis, using grants, and so most cannot permanently invest in their services. This is despite a huge growth in charitable giving from the public, directed in main at the NHS. In North West Surrey, we are looking at how we can give similar prominence to local charities supporting areas of deprivation and communities in need. But more needs to be done to enable charities and voluntary sector groups to be assured of ongoing funding to provide core services. Keeping such VCS groups active is essential to achieve insight into the needs of communities and innovative approaches such as Tribe, a technology platform developed by a technology business person, Richard Howells, simply because he had become so frustrated by the inabilities of the NHS and care services to deal with his own mother's care needs. Richard didn't write a research paper. He created a practical solution, which is pretty impressive. My Lords, when he shared this practical solution with the NHS centrally, there was lots of interest and fine words, but actually, in detail, no follow-through. My Lords, we now need to allow these insights at the most granular level to inform the commissioning and targeting of services. Without this, we will not be able to effectively respond to specific areas of inequality or health risks, leading to ill health and pressure on services. The existing models of voluntary sector support need to be developed to enable and promote micro-enterprise creation on a far greater scale. This both protects the quality of services and enables individuals to gain training, support and income. It has the potential to open up a currently untapped resource of care support, which is critical in places like North West Surrey, where community care staff vacancies run at around 40%. Employment and volunteering are themselves key determinants of well-being. Place-based systems will wish to use their spending power to leverage this benefit and invest directly in local employment where it can be demonstrated to the most effective use of resources. My Lords, in North West Surrey, we have achieved a virtuous cycle of supporting furloughed airline workers during lockdown through recruiting them into the hospital workforce, supporting the delivery of services and well-being of clinical staff, and reducing the risk of those individuals developing physical or mental health problems through inactivity and stress. My Lords, I can see that I'm being told that I'm running out of time, but before I do that, I just need to share two final things about the digital world. Sorry about this, but I think it's important. Richard Howells, who I've mentioned, is a successful data engineering entrepreneur who found, as I said, it hard to arrange care for his elderly mother. My Lords, I would suggest that government needs to actually, in the NHS, look in detail at what Richard Howells is doing. His project has recently been awarded £23 million in funding from UK Research and Innovation. The second data platform has been developed by Amir Hussain from Yemi Architects in Bradford, which is using the internet to get people off internal social platforms into bringing people together in communities. My Lords, I share these two amendments and I put them on the record because they are about the detail and practicality. The opportunity is there for transformation, but actually the worry out in our communities is this government, like others before it, going to be serious about transformation, or is it going to be about old men in new clothes?
159A, page 32, line 29, at end, insert the words as printed on the marshalled list.